Technique number 23 is the guillotine choke from the guard. Your objective is to finish the fight with submission, which is a choke from the guard position. There is no immediate danger as you are in a safe position and are on the offensive. If you're trying for the previous two moves, the Kimura and the sweep, your opponent will leave his head up and his neck exposed. Post up on your right arm. Sit up straight, making a little space between you and your opponent. Now you will wrap your left arm over and around his neck. You will then grab your left wrist with your right hand, locking your left arm tightly around his neck. Sit back and pull him back into your guard. Push your legs out straight as you lift your arms up toward your chin. This will close your arms tightly around his neck for the submission. Some common mistakes. Number 1, you don't sit back far enough to create space to get around his neck. And number 2, you don't lock your arms around his neck tight enough and he pops his head out. Technique number 24 is the guillotine choke from standing position. Your objective is to finish the fight with a submission, which in this case is a choke from a standing position. There's no immediate danger for you because you're in a safe position and you're on the offensive. If he were to break free from the choke, you would then be susceptible to a takedown. The technique. As your opponent comes toward you for a takedown, he lowers his level, which will place his head in front of you. As he lowers his head, wrap your right arm across, down, and around his neck. Now grasp your right wrist with your left hand, locking your right arm tightly around his neck. Turn your arms a few inches in toward the midline and lift slightly as you push your hips forward. Tighten as necessary until your opponent taps out. Common mistakes. Number 1, you get the guillotine, but with one of his arms in, which prevents you from getting the choke. Number 2, you don't lock your arms around his neck tight enough. And number 3, you use your arm strength and don't push your hips forward to place additional pressure on his neck.